So we've had another really successful year delivering social care services to people in Dorset during 2014-15, and a big focus during the year has been preparing for implementation of phase 1 of the Care Act that came in April 2015. So that involved a lot of work thinking differently about how we would support people to develop and improve their health and well-being, how we would get ready for new duties to meet the needs of carers, and how we would think about information and advice to people to make sure that they could take the best opportunity of great quality services to improve their outcomes. Like all organisations, we don't always get things right, and we need to improve and learn so that we really focus on what matters to people. An area that's been a real focus for us in terms of improvement over the last couple of years has been working with people in a person-centred way, so reducing process and bureaucracy and really focusing on what matters to people so that we can support them to achieve the very best lives that they can have. And that will continue to be a focus for us in the year ahead. In terms of some of the performance indicators, a big challenge for us is in relation to people who are in hospital and need to move out of hospital so that they can have their care met appropriately at home or in other settings, and we need to improve our performance in that area as well. This is a really challenging time to work in adult social care because of the financial context that we are working in. Austerity has been with us for a couple of years already, and that will continue to be the case. Funding is reducing whilst demands are increasing, particularly in a place like Dorset where we have an older than average population. That means that we can't carry on doing things as we've always done them. We need to transform so that we can really focus on what matters to people, and doing that in a way that is shoulder to shoulder with the people that we serve. So part of the challenge for us in coping with austerity, but also focusing on what matters to people, means that we've had some significant change programme within adult social care. The main programme is called Pathways to Independence, and the vision for Pathways to Independence is to support people to live independently for as long as possible, to reduce demand for health and social care, and to improve people's health and well-being. This will be our vision for the coming years, working with people to make sure that we can support them in the least intensive way appropriate with meeting their needs, and that we're really specifically focusing on what matters to people, what improves their well-being, and what makes them happy, because happy people are healthier people and much more able to cope with the challenges that social care needs bring.